Yeah, hi. So my name is Radwan Almousa. I'm an ophthalmology consultant. So I work with the NHS and also privately at the Wellington Hospital, and I do refractive surgery at my eye clinic as well. Ophthalmology is quite unique in terms of you'll be able to see patient in the clinic, interact with your patient, and at the same time you'll have the joy of performing surgery. And it's one of these few subspecialty in medicine that you can practice both. So you're not always stuck in the theater or in the clinics. You'll have both. I would say both sides the same time. And there's no end for learning in ophthalmology. It's like a continuous progress, continuous learning experience. So at least for me, I wouldn't get bored with that specialty. When I see patients happy with the outcome, actually, it makes me quite happy as well. Obviously, there's the quality of life as being an ophthalmologist. It doesn't abuse you too much, so you can have time for yourself, for your family, and obviously you have time for your patients. You have time to improve yourself and learn more about your specialty. When you see your patient happy, I think that's will say it all. I think they like the way that I explain the situation. If they have certain disease or if they suffer from a certain condition, I do my best to make it clear in a very layout language. And I keep myself open if they still have any question, even after the finish of the appointment. I always make myself available for my patient, so if they have any query, they can always come back to me. Because whatever I do, I'm pretty sure there's few information that I miss, and that patient still need to know. And I think that what makes me good at my job. I hope so. Um, and what I like about my patient is when they comprehend information, because obviously treatment, it's not only the doctor's job, it's like a mutual kind of a process. So if your patient want to improve and want to have a treatment, that would be half the way, and the other half is you delivering the information or the treatment. And I like it very I find it very helpful when the patient really listen and comprehend the information that we try to deliver to them. I like the new laser treatment, which called Smile treatment, and it's a way to improve refractive error. So many patients have refractive error, and they're looking to remove their glasses or get rid of contact lenses. So Smile is a very good option. It's safer than the previous refractive surgery, which is the LASIK. It's reduce the chance of having dry eye, which I think is great. So usually the downside of laser refractive surgery when they have a dry eye. So with the Smile, there's a less risk for that, and the visual outcome is the same. So it's quite a promising procedure. And also we started to incorporate new procedure for keratoconus patient, which is looking to be promising. For the keratoconus patient, which is a condition with the cornea when it starts to be steep, we usually ended up with a dead end. We can't provide any further treatment rather than observing or stop it from getting worse. Now we have a new treatment which improve even the vision. There's the new procedure was called CARES, which is about flattening the cornea with an implant, which is a alloplastic implant, which means it's taken from another cornea. And that looks to be quite promising. We started the training for that, and we actually we plotted the protocol in our clinic to start treating patients with keratoconus and to actually to provide them with help to improve the vision rather than just stopping it from getting any worse. And I think that's going to be quite helpful in the future.